Prior to 1895, it was impossible to see past the physical barriers of our world. Revolutionary X-ray technology allowed us to observe matter beyond these boundaries. This radical advancement brought global change in scientific fields and surgical practice. It was November 8, 1895. Physicist Wilhelm Conrad Röntgen was a professor at the University of Würzburg. Röntgen had been studying cathode rays in a Crookes vacuum tube, which is a glass bulb evacuated of air filled with gas and positive and negative electrodes. When a high voltage current was passed through, it would put off a glow. While experimenting, he noticed that a photographic plate in the lab would begin to fluoresce each time he turned on the electron beam. While he knew that fluorescent material ordinarily glows when struck by radiation, the tube was surrounded by heavy black cardboard, and the photographic plate was 9 feet away. This was unexpected, as normal ultraviolet and sunlight rays couldn't pass through. Initially, he wrote this off as the result of invisible rays coming from the tube. However, further exploration led him to believe there was something more.
Using the cathodes, he can see some fluorescence on a cardboard, and he said, okay, something means that something there that we cannot see. He couldn't say what it was, and they call it X because it was an incognite.
His experimentation went on for several weeks. Eventually, he placed his own hand between the tube and plate to find to his amazement that he was able to see through to the outline of his bones. One of his most iconic photos was of his wife's hand wearing her wedding ring.
X-rays are a type of radiation that we call ionizing radiation. And ionizing radiation are types of radiation that can actually take electrons off of atoms of a human body or of anything. It's just that the other types of waves just don't have enough energy to cause ionizations or cause the type of damage in living tissue that X-rays and gamma rays and alpha particles and beta particles do.
Less than 2 months later, on December 28, 1895, he submitted his first paper on a new kind of ray, a preliminary communication, to the Würzburg Physiomedical Society, as well as sending copies to friends around the world. In 1896, he made his first public presentation before the same society. The X-ray was deemed a medical miracle. For the first time in history, doctors didn't have to rely on external observation and their best guess at a patient's condition. Abnormalities such as broken bones, bullets, and tumors were able to be easily localized inside a person's body.
X-ray will have a certain device that can put the X-rays, constant flow of X-rays, and you can see on a monitor what is in the body, exactly the moment it's shooting the X-rays.
For their discovery, doctors simply had to go and do surgery on people to see whether or not that a bone is broken or whether or not they had a kind of disease in their abdomen or whatever it would happen to be, where now we can allow doctors to make diagnosis without being invasive or without cutting through the skin.
Soon after, Röntgen received countless scientific awards and high praise. In 1901, he became the first person to ever receive a Nobel Prize in physics. The hype following this newfound technology was overwhelming. As a service to the scientific community, Röntgen refrained from patenting his work on X-rays to allow scientists worldwide to improve upon his discovery. Within 1 year, over 1,000 scientific articles were published in relation to X-ray experimentation. Thomas Edison was one of the first to begin exploring the application of this technology, attempting to use X-rays to view real-time moving pictures of the inside of matter, called fluoroscopy. By the early 1900s, he had created a fluoroscope apt enough to be suitable for commercial use. The immediate response of the public following the newfound X-ray technology was phenomenal. The reaction, a sudden outpour of X-ray commercialism. From golf balls to stove polish to headache pills, Products worldwide professed similarities to this new light. Professional photographers were among the first to explore X-rays creatively, fulfilling society's need to look at what's on the inside and creating a new form of art, Röntgen photography. At first, in the early 1900s, physicians would send their patients to independent owners of X-ray equipment. But by 1910, most physicians had recognized the advantages to owning their own. However, due to difficulty deviating their time, the day-to-day operation and maintenance of X-ray machinery was designated to office assistants, secretaries, and nurses.
It's very useful for us clinically because it passes through the organs and it can go to a plate. We can see what is there. What is absorbed, is actually passing through there. It's like a photograph, but in different intensity because it's ionizing radiation.
It wasn't until after many casualties that the harmful effects of this kind of radiation were realized. Initially, it was believed that X-rays passed through our skin just as harmlessly as the visible kind. However, it soon became apparent that excessive exposure led to severe burns and skin damage.
At first, they didn't know what they did, and then when he and the other physicists were doing experiments with X-rays, even early on, they could see that after lots and lots and lots of exposure from X-rays, that it started to hurt people. It started to make their skin get very tight or brittle and literally burn.
In 1904, Thomas Edison's assistant, Clarence Daly, who had worked closely with X-rays for extended periods of time, passed away from skin cancer. After this incident, Edison abandoned working with radiation altogether. Arthur Muschler, in 1924, was the first to recommend a tolerance dose of 70 rem per year, which he declared to be adequate and livable. Over the years, the suggested amount of radiation exposure has continued to lower as radiation safety increases. The development of radiation dosimeters and Geiger counters have also aided in protection against X-rays by allowing radiation workers to measure their exposure.
Minimize now the amount of radiation that we can give to patients. We also minimize how much radiation that those of us in the field of radiology, how much we as individuals get on for occupational exposure.
The X-ray has paved the way for many innovations of today. What started as a simple radiograph of his wife's hand evolved into sophisticated machinery. Whereas Röntgen had used X-rays to look internally, other fields expanded X-ray technology to study the macro of the universe. In 1999, the Chandra X-ray Observatory launched into orbit just above our atmosphere as a telescope specially designed to take radiographs of places we can't see, according to NASA. Through X-rays, we are capable of learning more about objects that would have been impossible to see with the naked eye. The X-ray has developed industrial uses by allowing factories and businesses to scan for defects in products externally. Using this same technology, we use X-rays to scan for weaponry, hazardous substances, and drugs in security all over the world. The medical field continues to be the most significant area transformed by X-ray technology, even today. Real-time imaging has allowed us to diagnose medical issues through the ingesting of radioactive material and track it using X-rays in motion.
We can see the bones, we can see some of the tissues also that are soft tissue. For example, there is a kidney stones or some kind of blockage. If a kid swallows something, we can see it there.
We are able to see inside of even the most hard-to-reach places, like our intestines and other organs. The X-ray, discovered in 1895 by Wilhelm Röntgen, has paved the way for many invaluable innovations of the modern world. His accidental exploration of new light has become one of the most critical discoveries of today, providing new opportunity to observe the unseen world within us and around us.